Hey everybody, welcome to the TAV Oral Health webinar. This is take 2. My apologies. We had some technical difficulties yesterday with getting recordings to be completed. Anyway, we had a whopping 90 seconds worth of video that was saved from yesterday's hour and 45-minute webinar. So you're getting version 2, so be glad that you're getting the condensed version. I'll do my best to remember the questions that were asked from yesterday. Unfortunately, it is going to be different, mostly because there are no participants on this today, which I feel really weird sitting in this room talking to myself, but that's what happens when your webinar doesn't record. So there is no live feed coming through, so I won't be stopping and taking questions, but I should be able to remember just about everything that went down yesterday. So before we get too much further, I am Steph Chickering. I'm an oral health consultant at the Iowa Department of Public Health. I am the oral health person that has been a part of this system build from the get-go. This has kind of been my project over the last year, not quite 18 months, but it's been a long time coming, as you all know. So I was involved in the system build, the RFP writing, reviewing the demonstrations. So I've been working with TAV since they've been on board, and we're really excited to have a final product here within the next couple of weeks. I also want to remind you that if you have not done so already, you need to enable two-factor authentication. There have been multiple sets of instructions sent to agencies on how to complete this process, but when we go live on April 3rd, if you have not enabled your two-factor authentication, it will be enabled for you. And if you have not set it up beforehand, you are going to have difficulties logging in on that first day. And I will forewarn you, we are anticipating a lot of technical assistance being needed on that first day. So your requests are just going to end up in the queue with everyone else's, and we'll get to you in the order that the requests were received. So it could be a while, maybe 24 hours or so before we can get back to you, all depending on the number of requests that come in. So hopefully it won't be as many as we anticipate, but you just never know. So get that done if you haven't done so already. I am going to share my screen now. You no longer have to see me. Okay, and we are going to look at TAV Connect system. So before we dive into the system, I want to make you aware of just a few things. When you log into tavconnect.com, this is your dashboard page. This is the page that you get to when you log in. I've been doing testing for quite some time now, so I have a lot of contacts and a lot of activities on my dashboard. But I wanted to show you under the Records tab here, there are library documents available to you. And a lot of the things that we're going to discuss today are available in an IDPH user manual that is specific to oral health. So oral health, our document's actually on page 2 of the library, second one down. This is currently the most current oral health manual out there, but just wanted you to know that I am updating, excuse me, the manual. And so there should be a new one available by the time we go live on April 3rd. So if you're thinking about printing the manual, I would hold off for just a little bit. It's about a 26-page document right now, because it does walk you through all of the different episodes, activities, things that you might need to know that are specific to oral health. So just hold off because there is another one coming. So that's the library. There's documents in here for child and adolescent health. There'll eventually be one in here for maternal health, just some general scripts, some testing documents. The two-factor authentication instructions are in here as well, because you can still get into the TAV test site without two-factor. So you can still get into the website and pull those instructions. And just a bunch of other resources. So if you haven't been through here, do take a look around, because we have spent some substantial time writing these documents for agencies to use. Okay, the next thing I'm going to show you, since I'm hoping that many of you are familiar with just the basics of TAV Connect, I wanted to show you something from our actual test site. So I am a tester. I go in every week and I look at data that's been migrated from CARES into a TAV test site to make sure that the information that's being sent over is correct, that it's located in the correct spot, and multiple other things. So this is an actual screenshot of what is in the test site. So this is what the actual site will look like. This site here, let's see, shows some new features. So it shows over here, August 29th of 2016, it's showing Medicaid paid claims. So all of the paid claims data is being fed from Medicaid into TAV Connect, and it is showing Medicaid and MCO claims, so that we know when clients had services provided outside of our agency as well. You can click on this. This is just a screenshot, so I'm not able to show you that right now, but you can click on the reported dental visit, and it will open up and show you a few details, including the CPT codes that were billed for that date of service. But some other features that come in from that come into play when we're talking about the actual test site, it is bringing in things like Medicaid case ID numbers and Medicaid family IDs. So we're linking families together. It's bringing in country of birth as well as race, ethnicity, language, interpreters needed. It's bringing in services that were documented within CARES. It's bringing in related contacts and all sorts of other information, which is very, very excited. So I've gotten many requests to see what it looks like when Medicaid paid claims data shows up within TAV. So that is it for that. All right, so just to get back to the overview page on the dashboard, where we're going to start. I do have a series of questions that were sent to me before yesterday's webinar that I wanted to take time to address for everyone. And like I said, I apologize that yesterday's webinar did not end up recorded, but I am trying to do my best to add in information that was discussed yesterday based on questions from attendees. So first off, we need to select a client. I am going to select this particular client right here. She was the last one I used doing some things this morning, but I also used her yesterday in our webinar. So you generally will need to search for a contact, which you can do up here at the top. Since I have already used Katie Test a couple different times today, we're just going to use her for today's purposes. So one of the first things we need to do is find out if the client is within an oral health episode. So since we're just talking about oral health today, I'm mostly going to focus on the oral health episode. So all oral health services need to fall under the oral health episode, whereas all child health services fall under the child health episode. So right here on the left-hand side, it does tell us that Katie Test is a member of the oral health episode. And the first question that came in was about episodes, wanting to know if if that agency needs to release ownership of the client in that episode. If that client doesn't need follow-up, if the agency is not planning to follow up with them, do they need to release ownership? And so the response to that is really releasing ownership of the episode, so releasing ownership of the client, is really dependent on your agency policy. So Iowa Department of Public Health policies regarding releasing ownership of a client have not changed at all. So you would really only close the oral health episode. So here in our episode, we show that Katie Test is a member. We can close her episode status for two different reasons. One, if the client, if Katie Test were to age out of the program, and so she's no longer eligible for the services because she's aged out of the program, or we could close her if she's deceased, in which you could choose the deceased value in that episode. So really, if you choose to release ownership of this particular client, it might be because the client moved or, for whatever reason is receiving services from another agency. That's up to your agency policy how you do that. Because I'm an IDPH employee, it doesn't show here, but this caret up here will show options to add or release the client from your agency. So that is where you would do that. And again, ownership and release of clients, it's happening in the same scenarios as you do things today within CARES, so nothing's changing as far as that goes. So if you have any questions, be sure to let us know. Another question that came up about episodes was, what would happen if the agency would lose a Title V contract? Would they need to notify all of their Title V clients that they're now served by another agency? So yes, you would have to notify them. We don't anticipate this happening anytime soon, since we just had an RFP. Several agencies went through this this past fall. You would have to notify them. We'll figure something out for record keeping within TAV Connect as far as how that's going to work, but we don't anticipate that happening anytime soon, like I said. So really quickly to show you, if you would need to add an episode, this universal add button, this plus sign in the circle, is where you can add an episode. You have the following options right now: child and adolescent health, client overview, maternal health, and oral health. So again, we're just focusing on oral health today. I'm not going to add an oral health episode because Katie Test already has an oral health episode, and clients only need one episode per program. So she doesn't need oral health, but you could add her to child and adolescent health if she needed child and adolescent health services, and so on. So you can also use this universal add sign to add activities. So there's a couple different ways to add activities. You can add them individually. If you select the activity choice here, and it here, because Katie Test is only in the oral health episode, oral health is defaulting into the episode field. If the client was in multiple episodes, you would have to select you can enter the type of service within this field. There are multiple billable and non-billable services. Dental services are considered to be dental, in which there are many fields then that populate, including topic, which in this case, topic and type of service for the most part are going to be very similar. That's because topic is populated automatically within a activity bundle, which we'll talk about next. But the type of service is the actual CPT code that goes with the service. So we'll just select initial oral screen. Here you choose the ICD-10 code, Z code, and you would also add any K codes necessary. So when there's no abnormal findings for a dental exam, there is no reason to add a K code, but of course you would if there were abnormal findings. Interaction type, you select the type of interaction you had with the client. County of service is self-explanatory. Location, so if it's an agency visit, you're going to add in the specific name of your agency. If you're at a WIC clinic, you're going to add in the specific location of WIC clinic. It just can't just say WIC clinic. As you all know, chart audits would not pass that particular response in that field. And place of service is a new field within TAV Connect, and this the value that you select in this field has to do with how the service is reported on a CMS 1500 billing form. So every time a service is billed, there's a 2-digit code that has to be added, and so you will select one of those 4 options. Primary payer, self-explanatory. I do want to mention iSmile as a payer source is being removed once all data has been migrated into the final TAV Connect database. It's still needed in there currently while we migrate all of that data. It will be removed though prior to go live on April 3rd. Primary payer number, if known, should be entered. Secondary payer information, the service provider is going to default to whomever is logged into the system. If someone else is doing data entry for dental services, of course they would need to select the provider that provided the service. Quantity is only a required field for the dental sealant service. This is how we are able to bill the specific number of sealants that were placed. So it's not needed for all other services. And then prior authorization is not required for any dental service. And then at the bottom, we have the ability to add goals, barriers, organizations, providers, surveys, documents, and attachments. So one thing I do want to mention about adding surveys, anytime a dental screening is done, we do need to add a survey. We will need to add the dental risk assessment survey and answer whether or not the client has decayed teeth, failed teeth, sealed teeth, and then their corresponding risk level. So once that survey is done, we can save the survey and it will save within our dental service. All right, so that is how you add an activity. Activity bundles. So as you can guess, a bundle is just a grouping of multiple activities. So what we've done is combine the most commonly used activity services so that they load into this client's record all at the same time, so that you're not having to individually add 5 or 6 different activities. So the first one I'll show you is a dental screening bundle. So again, the episode pre-populated to oral health because that's the only episode this client is enrolled in. But when I clicked dental screening bundle in that bundle field, it pre-populated with several different activities. Pre-populated with a dental screening activity. If I go down a little bit further, we've got a risk assessment activity. That risk assessment is a separate activity so that it is billable. We've got an activity for fluoride varnish, an activity for oral hygiene instruction, and then a dental referral where we are going to capture the name of the dentist to which the client was referred to. So we've got all these services pre-populated. We're going to save that. And then what happens? Tab's loading this here. There we go. So in my timeline for today, I now have a bunch of dental services. So I'm going to remove this activity that we just talked about a little bit earlier. Something that is being worked on in the system still. There's 4 different dental activities right here. They are working to identify which type of dental activity. So these will eventually say dental screening, dental fluoride varnish, dental risk assessment, dental oral hygiene instruction, those kinds of things. So once we've saved that bundle, then that bundle pre-populates all of these activities, and then you can just click on the pencil and you can go in and edit all of your dental activities. So one question that came in ahead of time was, when you're entering multiple services like activities in a bundle, can the information that's the same for every single service, like the ICD-10 codes, the interaction type, the county of service, location, place of service, service provider, can you enter that information into one activity and have it carry forward, into the next couple of services? Unfortunately, at this time, that's not available. IDPH and TAV have been talking about this for quite a while. We've been doing a bunch of research as to how this can be done, but we're not able to do this just yet. But rest assured, we continue to look into this, and we're hoping that sometime in the near future that we can get this to happen. We realize it's a lot of duplication, but at this time, all of that information needs to be collected for each service so that each service is a billable service, so that you have adequate information in your report to be able to bill for all services provided. Another question that came up was if nutritional counseling, D1310, could be added to the dental screening bundle. So I don't care if it's added to the bundle. It's not a difficult thing to do. So I polled everyone yesterday and didn't get a whole lot of feedback one way or another, whether or not people wanted that added to the bundle. As of right now, it's pretty much 50-50. Some people use it, some people don't. So if you have opinions one way or another, if you'd like it added to the bundle, or if you don't, please let me know. Send me an email. So that is the dental screening bundle. I will tell you a little bit about some other activity bundles that are available for use. There's a care coordination bundle, and we'll talk a little bit about care coordination later, so I'm not going to open that one right now. I'll talk about community events in a little bit. we've got the dental screening bundle we just talked about. We've got the dental voucher bundle. So as you guys should all know, when clients receive services from a dentist using a dental voucher, all of those services have to be recorded into what was CARES and what will be soon in TAV. So we created a bundle for dental voucher services. And this is, we put together a bundle because generally when a client receives a service from a dentist, generally it's more than just one service. So we put, I think it's 5 different dental voucher services in this bundle. And then at the very end, there is a activity for dental voucher exception. Dental voucher exceptions to policy happen from time to time. So like with every bundle, if there's a particular activity within that bundle that you don't want or need, all you have to do is hit the trash can and it will delete from that particular client's bundle. But we wanted this activity to be readily available. So the dental voucher bundles are super easy to use. Again, just a little bit of information needed. Type of service, you would select the appropriate CPT code. You would enter the amount that was reimbursed for that service and the quantity that client received. So one CPT code, one day code per activity, which is why we gave you multiple. So that's the dental voucher bundle. What are we doing here? We also have risk bundles. So every time you have a client that is high risk, moderate risk, or even low risk, which you can see high and low in this view here. If you scroll down, there's 2 different moderate risk factor options. Of course, those are all based on our iSmile risk assessment tool. If you have a client that's high risk, you can add a high risk bundle to that client's record. And what this is going to do is pre-populate a couple different activities for this client. One of which is to send or give educational materials. This one I don't foresee this one being used as often with high-risk clients as I do low and moderate risk. But the purpose of this particular activity is to document that you provided something to the client or that you mailed them something. So I know a lot of agencies mail postcards. It's different periodicity postcards. So if you have a low-risk client and you don't need to remind them for 12 months that they need oral health services, you can you can schedule this through a risk bundle, and depending if you pick high, moderate, or low risk, it will pre-populate a date within that activity. So high risk client, you're not going to send them anything because you need to follow up right now. It's going to just give you the care coordination activity. So a high risk client obviously needs urgent care coordination. So every agency does things a little bit different. Some call, the next day, some call within the week. Sometimes it's a couple of weeks or even 4 weeks before you're following up with that client. So this care coordination in a high-risk bundle populates for 30 days from the date of service. Today's March 23rd, so it populated for April 24th. So if you save this activity, it is going to save it to this client's timeline. And it is going to tell you that on April 24th, this client is due for a care coordination call. So when you get into your dashboard, into your overview, you're going to see that somewhere. We're going to see that she's due for the care coordination on April 24th. If my connection and my connection's not wanting to do this today. So it works. I've done this before. You'll be reminded that Katie Test needs to have care coordination on April 24th. If that particular day is not what your agency has in mind for care coordination, you can just click on the calendar and change that. So I'm going to go back into an activity. I had a lot of questions about dental sealants and a dental sealant survey. We'll go back into activity bundles, actually. There is an activity bundle for I Smile at School. So when you're doing a sealant clinic, you're going to choose the I Smile at School bundle, and it is going to populate with several different dental services. We've got the dental screening. We've got the risk assessment. Sorry about that. We've got the fluoride varnish. We've got oral hygiene instruction. We've got dental sealant services. We've got an obtained documentation and a dental referral. So the first couple, the dental screening, the risk assessment, the fluoride varnish, the oral hygiene instruction, those are all pretty self-explanatory. The new one for this bundle is actually the dental sealant service. When I was showing you earlier, we talked a little bit about the quantity only being applicable in the dental sealant service. This is how we keep track of how many sealants are applied and how you guys will keep track of how many you bill for. The new thing in here is obtain documentation. So with every client, you can scan in consent or consent and release forms, or just the release forms. You can scan all of that information into a computer and save it into TAV Connect from the computer. So with an I Smile at School, things are a little bit different, and we can actually use the documentation for sealant services, for school-based sealant services, as the client's actual record. So if your agency chooses to actually go paperless for I Smile at School services, that's a possibility. So we did include the obtained documentation activity within the bundle. Talk a little bit more about going paperless in just a little bit. And then of course we have the dental referral activity. Of course, with all oral health services, every client is required to be referred to a dentist. And so this is the place where you would document who you referred that client to. So that is it for the dental sealant services. I'm going to save this. So it's going to show up at the top of my timeline here in just a second. Okay. So I have a lot of services up here in my queue from different testing I've been doing over the last couple of days. These look like my newest up here. So my dental service, okay, here's my dental screening. I am going to go into the dental sealant service. There we go. So a client that was receiving dental service, you would complete the information in here. Like we talked about, the topic pre-populates when you pull activities from a bundle. If you're just doing individual activities, you'll need to fill that in. But the topic is going to directly relate to the ICD-10 code that you choose. So what's really important about this dental sealant activity, if you are at a school-based clinic and you are going to place sealants on a student, you would need to attach this survey to the dental sealant activity. So this dental sealant survey is going to be done for every student that you see through your I Smile at School program. This survey is a mirror image from the dental sealant recording form, the paper form that you use currently to record your dental sealant services and findings. So this survey has to be completed regardless of the services that you provide to the child. So if you are providing services to a child at school, you are going to attach the survey to the dental sealant activity. This has to be done this way so that your dental sealants are a billable service. If you see a child at school and you're not providing sealants to them, you do a screening and you realize that they have sealants or they have teeth that are decayed and cannot have sealants for that reason, or whatever reason you might have, this survey needs to be attached to the dental screening activity. Everything needs to be completed within this survey that is applicable to that child. We understand that sometimes on a consent form from a parent, some information is not always completed. For example, free and reduced lunch rate. Parents don't always respond to that, whether or not the child has a dentist or when their last dental visit was. There's multiple questions on that consent form that are not always answered. If a parent doesn't answer, you can leave that field blank in this survey. All right, so walking through this survey here, you can start, the school field is just a school name, nothing new there. School district, also looking for the district name, the grade level of the student that you're working with, whether or not they have free and reduced lunch rate, whether or not they have a dentist. You need to indicate whether or not you reviewed their medical history. Indicate their most recent dental visit if one was reported. And then you're going to pick the type of screening, whether it was done by a hygienist or a dentist, and whether it's an initial or a periodic screening. You're going to look at hard tissues. You're going to indicate whether or not visible plaque was found. You're going to indicate whether or not there were problems with the soft tissues or if no problems were found. As with the paper form, if problems were identified, if you needed to indicate that there was gingivitis and or one of the other options, you would need to describe that situation below in this box. You'll also take a look at hard tissues, indicate problems or no problems. If there's a problem found, you would also need to describe that. And then indicating whether or not sealants were applied and the date that they're applied, the product used, whether or not fluoride varnish was applied, the product name and concentration, and then whether or not the education was given to the child. Now, I do want to point out that this particular field, this is not asking about oral hygiene instruction. This is, did you discuss education with this particular child while they were in your chair? There's always an opportunity to talk to kids And it might not be billable education, but it's do you have a toothbrush at home, or do your mom and dad help you brush, or things like that. Make sure you brush your teeth twice a day. The education that you provide to the child should be indicated. We've given you some generic options here, along with none, which I know sometimes does happen. But if you do mark other for that education, be sure to note it in this field, the education notes field. And below that is whether or not oral hygiene instruction was provided. Yes or no. You'll do time in, time out. And then I also want to point out that oral hygiene instruction does require a narrative about the demonstration that was provided to the student, and details on what was discussed. So you can do this in the education notes field as well. Make sure you include a time in and time out, as oral hygiene instruction is a billable service based on a minimum of 8 minutes of time. Then you'd indicate whether or not varnish and sealant post-op information was sent home with the client. So this information is the tooth-specific information that was noted on the dental screening. So the exam, the boxes that have a tooth number and exam, this is where you record the information that was found upon your dental screening. And then the tooth number and sealant boxes are where you record whether or not a provider from your agency placed a sealant on that tooth. So these fields, the engineers at TAV Health have created fields here that only accept certain codes. So the codes that are being used are the codes that are on the dental sealant recording form, the standard form where we use the codes 0 through 5 to indicate conditions on permanent teeth, and then A through E, I believe, for conditions found on primary teeth, and then an S for sealant, of course. So these boxes here, will only take certain codes. If I try to enter a 7, it's not entering into this box, but if I were to enter an E, it does. Currently, right now, the sealant fields are accepting the letter S, but only a capital S. So I have requested from engineering that a lowercase s be acceptable within these fields, just for ease of use with this particular part of the survey. So, just make sure that this is all filled out, just as you would any paper documentation, and you can save. So you can save that survey at any point in time during the survey. Unlike Iowa grants that requires something in each field before you're able to save, you can save the survey at any point in time. There are no required fields currently within TAV Connect, so you can save it at any point in time. One other thing to mention, survey, is that you are not currently able, let's see here, to use the tab button to tab through all of the services. So up here you can use the tab key to get from field to field to field, because we have those bubbles within the dental sealant survey. You're not able to tab through them, but I am told that it is quicker and easier to actually get through the survey using a mouse than it is to use the tab button. So take that into consideration. We've talked about that internally and with a few testers, and it was decided to leave the survey the way it is now. So a question that came in, how much of the information in the sealant survey needs to be filled in? All of the questions that are asked on that survey are on our paper documentation. It all seems like a total repeat. So yes, it is a total repeat. And that is because starting April 3rd, we are no longer entering any sealant data into iowgrants.gov. So we're discontinuing the use of iowgrants.gov for sealant data entry. We're going to continue to use iowgrants.gov for contract management purposes, but not for sealant data entry. So by entering the services within TAV Connect, we are totally getting away from having to use Iowa Grants for anything sealant. So that's why it is a total repeat. It's all the same, but eventually it's not going to be a repeat because there's going to be no more Iowa Grants. We already talked about this, but the survey, the dental sealant survey, if the client receives sealants from the agency, that dental sealant survey has to be attached to the dental sealant activity. If sealants were not provided to someone within the iSmile at School program, that dental sealant survey can be attached to the dental screening activity. See here. Okay, another question that came in ahead of time. Most of what is included on our paper forms is accounted for with the survey. Are we able to maintain a paperless chart if we were to scan in the consent and release form and attach it to the screening as well? So I know I talked a little bit about this earlier and said we'd discuss it here. So here we are. Since you can scan in parent consent and release forms, you can essentially, for the iSmile at School program only, you can essentially get away with having a paperless client record. So if you scan in the consent and release form and you complete all of the documentation for the iSmile at School services that were provided, a paper chart is not required. I do want to note that essentially with electronic records, since there is no provider signature within this electronic record, it does say who the service provider is. You must have a signature log within the agency with the provider names and signatures. In the event that there was ever a Medicaid audit, you would need to provide that information to them. So please follow up with me if you have any questions about doing away with paper records. We at IDPH are not requiring this to happen, but I know some agencies are looking into it with the ability to do real-time data entry, and the fact that the Attorney General now allows electronic consent and release forms. This is a very practical way for agencies to collect sealant data. So if you have questions, please don't hesitate to reach out to me. I'm happy to answer individual questions about this. So there was a question about an intake assessment. So I'll show you really quickly. I'm just gonna pull this up here. An intake assessment is a survey. It's the information is collected as a survey within TAV Connect. But these are all of the questions that were asked in CARES, and they were all, there were a couple questions in a couple different places within the CARES system. And so all of the questions have been put together into one survey. And the user manuals within the library in TAV Connect indicate that this information needs to be updated at least monthly. So the question came in, says, I understand that this information needs to be updated whenever we make contact with a client. Do we just save any changes on the existing assessment And do we make a note on the care coordination that we updated the assessment? So you are going to, the first time you make contact with a client, you're going to ask the client all of these different questions and record it in this survey. These are the medical home and dental home questions. There's a few new ones about immunization, the source of immunization records, and developmental delays or disabilities. You're going to complete the survey, you're going to save the survey. So when you save the survey, let's see if I can, it is going to show up as an intake assessment. So as you can see over on the left side of my screen, it shows an intake assessment over here. And you hover over it, it's going to tell you the date of that intake assessment. So if you made a mistake in the intake assessment and you need to edit that, you can open it back up and make the changes within that intake assessment survey. If you have updates to make, so if you are contacting the family a month down the road or even 6 months, a year, whenever, and you have changes to make to the survey, you need to complete a new survey. The reason being is that those intake assessment surveys don't override each other. So in order to have a running tally of everything that the client reports, we need to have a new survey completed when there's a new response to questions. If you want to, based on agency policy, you can make a note of changes within the intake assessment, in a care coordination note or a service activity note, wherever you want to type it, and that may help you with your case management. But if you have changes to make to an intake assessment, please do make sure that you complete a new one. And I said earlier too, and it's written in the user guide, you should be asking clients these questions from the assessment on a monthly basis. So we know that you don't talk to every client every month, and that's acceptable. We just needed a way to state that you don't have to ask the client these questions every time you talk to them. We know that some families have multiple children enrolled in multiple programs within your agency. And so if you're talking to these parents, I know it's sometimes a couple times a week, sometimes it's a couple times a month, there's no reason to ask those questions unless they provide you with information that something may have changed. But at a minimum, be sure that you're asking the families once a month. If you don't talk to them for 6 months, don't call them to update their intake assessment, but do make sure when you talk to them 6 months down the road that you do get an updated assessment. All right. Some questions have also come in about care coordination. So I'm going to take a look here at the care coordination bundle. When I choose a care coordination bundle, it's going to give me a care coordination referral and a care coordination activity and a follow-up call. And this is a standard activity bundle. But what I wanted to do really is highlight, again, as you guys know, care coordination is a billable service. This is when you talk to a client, you talk to them on the phone, you talk to them face-to-face, or you text them and get a response, or you email them and get a response. This is communication with the family that's linking them to a service, and it's billable service. So that's care coordination has not changed at all. But as you all know, in CARES, we had what was called a service addendum. We don't have service addendums in TAV Connect. We have what's called a follow-up call. We're using follow-up call activities to document non-billable care coordination. So follow-up calls can be, notes where you attempted to reach a client but had to leave a message, or attempted to reach a client and the number was no longer in service. It could also be a reminder for you, for it to show up on your dashboard, for you to call them to remind them about an upcoming appointment, or to remind yourself that you need to collect paperwork or documentation of some sort from the family. It's how you document all of the activities and interaction you have with families that aren't billable. So that's what that is all about. Let's see here. I had a question come in about calling specifically for dental care coordination, whether or not the agency needs to address medical appointments. So the rules around care coordination, specifically targeted care coordination. So if your care coordination call is strictly for dental, follow-up on medical appointments is not required. The policy on that has not changed. As you know, it is best practice to follow up on medical care and medical providers and similar information, but it's not required if it's a targeted care coordination phone call. And I would also refer you to all of your care coordination guidelines that you have received multiple times from Kelly. One other thing that came in as a question, I'm going to cancel out of this. Apparently I'm going to cancel out of a couple different things here. We have a dental activity. Just like in CARES, well, similarly to CARES. In CARES, we had both barriers and needs. And it was very confusing to most users, the differences between needs and barriers. So in TAV, we are just going to be using barriers. Barriers are equivalent to all of the barriers and needs that we identified within CARES. So when you provided a service in CARES, you identified a need for each service that you provided. So if you provided a dental screening, fluoride varnish, oral hygiene instruction, and a referral, you provided a need for each of those services. So the question that came in is if users are required to enter a barrier for each service within TAV Connect. So the answer for that is no. You will not need to identify a barrier for each activity documented within TAV Connect. You will need to identify at least one barrier per visit. So a visit being, a group of services provided on the same day, we'll need one barrier entered into the dental screening activity. So to do that within the dental screening activity, you're going to come down to the bottom of that activity, click on the barrier tab, and you are going to select different barriers. So one of the additions that's happening to the TAV Connect Oral Health User Guide that will be in the library is a crosswalk of the barriers. There were a handful of dental specific barriers within CARES. So we have, I have shown the equivalent of those barriers to the language that TAV Connect has. If you've been in the system, you know that the language is just a little bit. So instead of no dental home, in TAV, it's the access to care dental home identification. So you're going to You're going to choose at least one barrier for the service. Of course, if there's multiple barriers, you need to document the multiple barriers, but you don't have to do it for every service you provide on that day with the client. Attach it to the dental screening activity, and you'll be good. Sometimes, let's see here, sometimes when there are multiple, you'll indicate a barrier, you'll save it, and then you'll go back in to the activity, and you can add another barrier. And save it as well. So if you have any questions on barriers, be sure to let me know. Of course, with all barriers, TAV wants you to find a solution to the barriers. And we just discussed in a meeting this morning how we're going to address solutions for all of them. It's my understanding that within the community guide, which you all provided, community guide solutions to the barriers through community agencies, the programs. So you should be able to find a solution in there, but we know that not all barriers are going to have solutions. So stay tuned on how we're going to handle all of that. Of course, we would like to see as many barriers have solutions as possible, but we know that's not always going to be possible. Okay, so I'm going to just go back up to my overview for just a second. The next couple of questions that came in ahead of yesterday's webinar have to do with billing. So the first thing that came in, agencies were wanting to see a sample of the billing spreadsheet. So this is a sample billing spreadsheet. This is the CMS 1500 claim form report. The data that's in this spreadsheet is all test data. So there is no confidential information on this form, just wanted you to know. And it was pulled for all of the agencies within the IDPH population in TAV Connect. So when it comes to your agency, it's going to only be your agency information. But the persons that requested this report were just looking for reassurance that this report contained all the information needed to bill for services, specifically the number of dental sealants, and they were looking to see if the billing report could be filtered. So TAV sent us this report, which they will be sending the report. I'm not sure yet if TAV is sending it to IDPH and then we're sending it out to each agency, or if TAV's going to send it directly to the agency. But when they send it, it will be an Excel file, either a CSV file or an Excel spreadsheet. And you will have the opportunity to filter all of your services. So as you can see, there are a lot of different fields in this spreadsheet containing all of the information. So you can filter information based on insurance numbers, the insurance plan, whether it's Medicaid or an MCO, and which MCO. You can filter through date of service. You can filter through place of service, type of service. Column CE of the billing report is the number of teeth sealed. So again, all of this information came from the test site, and there were no number of teeth sealed within the test site, so there's nothing showing up here. But if there were in the test site, it would show up here. So you can filter on that, and then even right here, column BW is the name of the provider. This says signature of physician or supplier. So the supplier would be the provider. And if you don't know how to sort, you can sort on multiple different levels of information. So you could, I just have that one column selected right now, but you could sort. Let's try this again. There we go. You could sort using column BW with a provider name. You can add in another level and sort then based on column CE. And it's not going to do it because some cells are merged, but you should get the picture that you can do that. If you need help sorting and filtering through Excel documents, be sure to let anybody at IDPH know. We do this all of the time, but I just wanted to reassure you that that information is included within the billing spreadsheet. Another question about billing came in about verifying how billing spreadsheets will be pulled, whether they'll be pulled by the date of entry or the date of service. So as of right now, the billing reports are going to be pulled weekly, and they're going to be pulled based on the date that the data was entered or modified within TAV Connect. And the concern around this was not every agency can do real-time data entry. Sometimes the data is not entered until a later date, so maybe later that day, later that week, maybe even later that month before just before the deadline. So agencies were concerned about data being pulled on a weekly basis if they're not getting their data entered right away. So the reports are going to be pulled on the date the data was entered and modified. Discussions about this continue to happen in our weekly reporting meetings. When there's a final decision, we'll be sure to let everyone know. So I'm going to close out of that form. And then one other thing, the last question that came in from an agency prior to yesterday's webinar had to do with public health supervision reporting. So one thing I wanted to mention about the public health supervision reporting is that TAV Connect has capability to filter all sorts of data. So if the service is entered into TAV Connect, you'll be able to pull data out for that service. So you'll be able to filter and sort based on provider types, the services that provider type provided, the dates of service, the numbers, anything and everything you could basically want, you can filter and sort through. So tracking services is going to be a lot easier through TAV Connect. So it's going to make your public health supervision reports that you do every January just that much easier. So public health supervision reporting is still required, but TAV Connect is going to help you collect that data. So one thing I wanted to show you, and this is new since super user training back in February. Every agency has an events account within TAV Connect. So it's an event contact, I should say. So here in my queue, I have Family Inc. events. So there's going to be a VNS events. There's going to be a HACAP events. There's one for every single agency. And so you can enter information on population-based services that you do. You don't have to enter it within TAV Connect. I'm highly encouraging you to enter it within TAV Connect because it's just an easier way to keep track of all of the information that you collect through the year. So you can search for your events contact, or you can select the one that's in your queue. You'll have to search for it the very first time you use it. What you're going to do is either add an activity or an activity bundle. I found that it's easiest to add a population-based event using an activity. It's one service that you're reporting. It's one activity you're reporting, so you don't need multiple things. There's only one activity within the bundle, and there's just a few more steps to have to fill out. So just a single activity was the easiest way I found to do it. You're going to select your episode. And then you're going to select a community event. It's going to pre-populate the owner as the person that's logged in to TAV Connect. It's going to pre-populate today's date, time, duration, description, obviously all optional. An outcome, if you're entering anything, it's going to be successful. And then you're able to select an event type. So we've done lots of brainstorming. I've reached out to several different iSmile coordinators, and these were the different types of events that we could come up with. Health fairs, school screening events, and other events. We know there's some others out there. There's some events that happen at local fairs and that type of thing. Excuse me. You're going to enter the location and your comment. The one thing that I can't show you yet is you're going to add a survey to this particular activity, and you're going to be able to track things like the number of open mouth screenings provided for the two different age groups, the 0 to 20 and the 21 and older. You're going to be able to enter the number of individual counseling and education services. You're going to be able to enter the number of referrals and urgent referrals for those two age groups. So all of that information that you have to report in your public health supervision, I've built this community event around public health supervision reporting. So again, you don't have to use it, but I would suggest that you use it. It has all of your information stored in one place. So then when it's time to do the actual report in January, you can pull it right out of this system. So this is also an area of the user manual that is going to be updated when the system goes live on April 3rd. I'm still just waiting for engineering to complete the building of those surveys. So that is all of the questions that I had received from users prior to yesterday's webinar. A couple things to discuss before I stop the recording. Let's see here. I had someone ask yesterday about moving the survey from activity to activity. So if you start a survey in the dental sealant activity because you're seeing somebody for iSmile at school and you're anticipating providing sealants to that child, but when they get in the chair and you do the screening, they already have sealants and you no longer need to do sealants. If you've already started that survey within the dental sealant activity, you can't move that survey to the dental screening activity. So wherever you start that survey is where you have to save it and keep it. But remember, it's really important that that dental sealant survey, you provide sealants, that survey has to be attached to the dental sealant activity in order for your agency to be reimbursed for those sealants that were applied to Medicaid eligible kids. So it's really important to remember that. So I know a lot of agencies, work ahead, make sure, try to get things entered into the system. So if you're doing real-time data, try not to get too far ahead of yourselves. Don't start that survey until that client is in your chair, and if you know they're going to need sealants, then you know the proper place to attach that survey. Again, let's see here. Dental data reports, all of the voucher information, it's entered into the system, including all of the CPT codes of services that clients receive at dentists using voucher funds, and all of the reimbursement for exception to policies are in TAV Connect as well. So the last reporting meeting that I had on Tuesday, they debuted what the dental data report will look like, and it looks like we will no longer need agencies to fill out dental data reports as long as all of the information for voucher clients is entered within TAV Connect. So that's one less report to have to do down the road. And I also wanted to highlight that when you're doing dental care coordination, of course within the care coordination activity, give it a second. There we go. We're doing a care coordination activity here. There we go. Moving slow on Thursday afternoon. You're gonna have two types of service you can choose from: care coordination medical and care coordination dental. So if you're calling a client for dental care coordination, if you're billing for dental care coordination, you need to make sure that when you are completing the care coordination fields, including the contact person, the concerns and issues addressed, staff response, medical appointment summary, dental appointment summary, you need to make sure that the primary concern or issue is a dental related concern or issue. The reason for that care coordination, for dental care coordination, that a dental reason needs to be a dental reason. So just make sure that you record that if you are doing dental care coordination. So that is all of the information that I discussed yesterday, I think, with everybody on the live webinar. Again, I apologize, you're getting a re-recorded version. But as always, if you have questions about TAV Connect, feel free to let me know. As the primary person, the only person really from oral health that's been involved in this system build, I'm happy to take your questions. I do anticipate April 3rd being a hectic day with CARES closing down at the end of the day on March 30th, and the TAV Connect test site going down also at the end of the day on March 30th. I do recommend that you get in the system, play around, make sure you get your two-factor authentication turned on, and feel free to let me know if you need help with anything. I'm happy to walk you through anything that you might still have questions or concerns about. So again, be on the lookout for a new updated oral health user manual that will be ready to go prior to go live on April 3rd. And thanks for listening. Let me know if you have questions, and have a great day. Thanks, everybody.